but the family does have to agree if they go on hospice that at the time the individual gets to the point where they're going to need someone helping them 24 hours a day, that they can provide that. Either the family taking turns, somebody, daughter getting off work, family can take turns providing that care, or it could be done in a nursing home. Most hospice agencies have contracts with various nursing homes in the area where the stay in the nursing home, that becomes their 24-hour caregiver. And the hospice goes to that nursing home to provide that service. They're excellent in terms of knowing, those nurses that work in hospice are excellent at knowing how to make the patient comfortable, to know about pain medications and this type of thing, because the idea is that they should be as comfortable as possible. The difficulty is that the hospice will not pay for the room and board at the nursing home, so there needs to be some source of payment for the room and board at the nursing home. And that could be Medicaid if they're on Medicaid, or it could be private pay. Okay. Someone in the audience think I've maybe left out some services in the home that should be added on here? Any questions about the services in the home? I'm going to quickly, on the blue sheet, run through the levels of care. If you're looking then, okay, they have to move from that, from their home into some other type of living arrangement. So I'm going to, again, start with the least restrictive ones and then go to the heavier cares. And I specifically mentioned that this is based on Indiana terminology in terms of licensure. Other states may use different licensure. I know that when I was calling around in Texas for my parents, assisted living actually almost meant skilled care, what we would consider skilled care here. So you just have to be careful that you understand in another state what that definition is. And again, your area agency on aging or your social worker in a hospital could help you with that. But assisted living facility is kind of the first one that I've listed here. Again, this is another type of arrangement that has developed in the last several years. And so we now have, I'm not sure, we may have about, if you count the continuum of care, we may have 6 or so assisted living facilities. Both Westminster Village and University Place both have assisted living within their whole continuum of care. But it is, they're like a little mini apartment or an efficiency apartment, you might call it. They have a little kitchenette type of thing usually, but the individual, all meals are provided. If they want to have breakfast in their room and fix it themselves, they can, but the meals are all right there. They have someone to assist them with medications if that's what you want. Usually it's kind of like a smorgasbord of what you would want to add on, and different facilities as you check in would assess the person and determine what their needs would be and what additional services they may want. They may be independent and do their own bathing, or they may need a bath 3 times a week or something like that. So the cost would change based on the amount of care that they would need. But the places we're talking about locally would be like Rosewell Commons, Green Tree, Bigford Cottage, Digby House, and like I said, the University Place and Westminster both have those within their areas. Mulberry has some assisted living areas, but they can be as independent as they want to. And as we were talking, I see people that are very busy and they're going out with their daughter and they're doing all sorts of things, or maybe they're even driving themselves too. So, in fact, one of my ladies at church, I went to tour Green Tree and saw my friend Pat, and she was doing her laundry down the hall, and she said, "Oh, this is where my PEO group meets," and this is, and she gets in a car and drives to church every, so they can be very independent. But I find that the good thing is that they've made that major change from being in their home, which to give up their home, and to just the whole process of moving from their home is so dramatic, regardless of how old you are, how young you are. They've already made that decision, so they've had to downsize way considerably. So that's a huge part of, they've made that probably, I think,